السلام عليكم. سيميناري بعنوان cervicofascial fasciitis necrotizing fasciitis. What is it? Necrotizing fasciitis is repeatedly progressive inflammatory infunction of fascia with secondary necrosis of subcutaneous tissue. The speed of spread is directly proportional to the thickness of a subcutaneous layer. Necrotizing fasciitis moving along the facial plane. Necrotizing fasciitis has also been referred to as hemolytic streptococcal gangrene, malign ulcer, acute dermal gangrene, hospital gangrene, suppurative fasciitis, and synergistic necrotizing cellulitis. Foreigner gangrene is form of necrotizing fasciitis that is localized to scrotum and perineal area. The etiology: the bacteria type 1 polymicropol, type 2 most common group beta hemolytic streptococcus, type 3 marine vipera. Surgical procedure may cause local tissue injury and bacterial invasion, resulting in necrotizing fasciitis. These procedures, including surgery for intraperitoneal infunction and drainage and perineal abscess, intermuscular injection, and intravenous infusion, may lead to necrotizing fasciitis. Also, minor insect bites may set the stage for necrotizing infection. Streptococcus introducing into the wound may be prominent initially, but the bacteriological pattern change with the hypoxia, inducing proliferation of anaerobes. Also, local ischemia and hypoxia can occur in patients with systemic illness, for example, diabetes, whose defense can be compromised by underlying system disease, favoring the development of these functions. Illnesses such as diabetes or cancer have been described in over 90% of cases of progressive bacterial gangrene. So, risk factor, as we mentioned, diabetes, chronic disease, immunosuppressive drug, for example, prednisolone, malnutrition, age more than 60 years, intravenous drug misuse, peripheral vascular disease, renal failure, underlying malignancy, obesity. Clinical presentation: early signs and symptoms within 24 hours. We can see trauma, minor injury occur, pain in general area of injury, pain in disproportionate to the injury. For example, getting a paper cut and feeling like you have been cutting 25 lbs for 2 hours. Flu-like symptoms. Advantage signs and symptoms in third day or fourth day: swelling, tenderness, purple plasters, skin and maybe appear mottled, purple and flaky. Critical signs and symptoms in the 4 or 5 days: severe drop in blood pressure, toxic shock, inconscience. Addition: in males, we must know the scrotal subcutaneous layer so thin that most patients present after the skin is already exhibiting signs of necrosis. In 2 to 7 days, the skin becomes necrotic and characteristic black spot can be seen early in this infection. It may resemble acute orchitis and or even strangulated hernia. In women, foreigner gangrena act more like necrotizing fascitis because of a thicker subcutaneous layer involving a labia majora and the perineum. Thank you. Thank you for listening.